Hello friends, I am Dr. Chaitanya Vaidya and I am going to tell you about one remedy which is known as Hamamelis. Now when we consider Hamamelis as a patient, when this patient narrates their story to us, then how can we differentiate Hamamelis from different other homeopathic medicines having various personalities? Now, when this Hamamelis patient comes to you and tells about his story, in his story you will find that one key thing, one red strand, which is that this patient is not at all being appreciated or respected. So, this is the point in which you have to think about Hamamelis. Now this Hamamelis patient always have ailments from not being appreciated. So ailments from not being appreciated, ailments from humiliation, ailments from reprimands, ailments from the loss of reputation. He thinks that he is a very reputed person. He may be, and he thinks that he is a very great person and he ought to be respected and reverenced by everyone. But this is not the scenario in his case, and when he does not get that appreciation, then he starts suffering from various kinds of disease. Now let's think why this patient wants so much of appreciation. This is because even the slightest criticism leads him to sadness. He is a very despondent person who easily gets sad, who easily starts weeping, and who always get in that gloomy phase. Now, when we think about this remedy, Hamamelis, we know that this person might also become angry. Not only sadness but also anger is in this remedy. So when this person will become angry is that yes, because he is not appreciated, but the most important thing is that this person thinks that other people have misunderstood him. Whenever he thinks that other people has misunderstood him, then he becomes angry. So this is a very good rubric in repertory, that is anger misunderstood when. Now let's think about another states in which we can prescribe Hamamelis, that is when he starts lamenting about his own sickness, when he starts complaining about his disease, then we can think of Hamamelis. We can also think of lachesis, because lachesis is also there in lamenting about sickness. But the lachesis, the main problem in lachesis is not that he is not being appreciated or not that he is not being respected. In lachesis there is another problem. But in Hamamelis, the problem is only this, that he is not being appreciated or he is not being respected. So he will start lamenting about his sickness. He will be confiding things in himself, which others would have told him. The secrets of others he will confide in himself. If the Hamamelis is a wife, she will accuse her husband that he is neglecting her, that he is not appreciating her, he is not seeing the efforts she is being doing. So she always thinks that the husband is neglecting her. So this is a rubric. Jealousy accuses husband of neglect. In this, the jealousy point has come The jealousy here means that she is jealous of her husband when he is putting his attention towards someone or towards other people in the house, but he is neglecting her, or he is giving more attention to the work, more attention to his colleagues, and he is neglecting her and her efforts and not appreciating her. So at this time you have to think of Hamamelis. Then in Hamamelis there is a desire for having certain kind of conversations. If Hamamelis get this type of conversation, the patient will feel very happy. So what are these kind of conversations? These conversations are sublime conversations. Means conversation, desire to have sublime conversations. Now what is this sublime? What does it mean? Sublime means having sweet and honest conversations in which the other person is showing respect. So when certain kind of conversations in which there is, in that conversation there is respect, that kind of conversations are sublime conversations. So this patient, this Hamamelis, always wants to hear this type of conversations, and what they are most sensitive is to the conversations in which there is criticism, in which people are criticizing them, in which people are reprimanding them or showing reproach. So these kinds of conversations they do not want, but they want sublime type of conversations in which people respect them. Now jealousy is in another form in this patient, that they desire that others shall not appreciate anything. They always think that others will not appreciate it, anything whatever they do, and whatever others do, they think that people appreciate them only, and they do not appreciate whatever things they are doing. Means other people are getting appreciation, but they are not getting appreciation. So this kind of jealousy is seen in Hamamelis patient. Now this patient also has a desire to be watched. Desire to be watched in a sense that whenever people are watching them doing certain good things, they will always think that people should appreciate them. Then weeping when thanked is also there in Hamamelis. Now whenever you thank them for anything which they have done very good for you, then it shows that you are respecting them, you are appreciating them, you have told them thank you. Then when they get that appreciation, when they get that respect, that sublime conversation of a simple thank you, they will start weeping. So this is a kind of state which we find in Hamamelis patients. Now opinions, whenever they have certain opinions about anything, any circumstances, anything which they are dealing with, when they have certain opinions regarding that situation, then they always think that people should respect their opinion. They may accept their opinion or they may not accept their opinion. It does not matter to Hamamelis patient if people do not take their opinion and do as per their opinion, but they always think that at least the opinion which they had in that situation, that opinion should have been respected. It should not have been just thrown away. People should listen to them, people should understand what their opinion is, and then they should at least appreciate that opinion. So So this is the thing, this is the kind of mental state which we find in Hamamelis. Another thing, whatever I have said you earlier is that respected, desire to be respected is there in Hamamelis. There is sadness from undeserved slight. Now let's understand this word slight. Slight means a kind of a reprimand, a kind of reproach, a kind of blaming, or a kind of criticism which is done on a person. But the main key word in this rubric is undeserved. They always think that they did not deserve this kind of reprimand, they didn't deserve this kind of criticism. They will always say that I didn't deserve this. Whatever this person has told about me, whatever this person has criticized me, I didn't deserve that. So, this sadness, they become sad because of this undeserved slight. They always think that they didn't deserve this kind of reproach, but they always think that they deserved to be respected. They deserve their opinion to be respected, or whatever they have done that should be respected by other people, and they always become sad when they are reprimanded or reproached or criticized. Then we come to another rubric, that is lamenting because she is not appreciated. When she thinks that she should have been appreciated by those people, by anyone, but they are not appreciating her and not showing their respect towards her, then she starts lamenting. Now, there are certain kinds of delusions in this remedy which we should know. Delusion that she is being looked down upon means that people think that she is of a low level, of a low grade, of a low state, and do not respect her. Then this delusion comes up. These people, these Hamamelis people, will think that people are always underestimating them. So this underestimate, if you don't find this word in the repertory, that is underestimate, always think about this rubric, delusion, look down upon she is. Then comes delusion alone, being she did not belong to anyone. No one belonged to her, she did not belong to anyone, no one is respecting her, and no one says that she belongs to him. So this kind of feeling that she does not belong to anyone, that she is forsaken, and no one would care for her, this kind of delusion is there in Hamamelis. That she is forsaken, she is just left alone, and no one will take care of her, or no one will take care of him. This kind of feeling is there in Hamamelis. Great person, she is ought to be reverenced by all around her. This delusion that she is a great person, he is a great person, but not only a great person, but all the people around should respect her, should respect him. This kind of feeling, this kind of delusion is there in Hamamelis. And there is also one kind of delusion, that is whenever she had slept, she thinks that she has not slept enough. and this feeling comes in the morning. So I think I have covered most of the Hamamelis rubrics, especially related to the personality of Hamamelis. So let's give a quick review. The Hamamelis patient desire to be respected and desires that their opinion should be valued, their opinion should be respected, and they become sad if people criticize them, if people don't respect them, and if people do not value their opinion, and they will start weeping when they are thanked, and they will start weeping when they are appreciated. So let's move into another remedy next time. I think I have covered most of the Hamamelis remedy and its mind. So please use these kind of rubrics in your daily practice. And yes, I also want to say you that you must use repertory. I have seen many times that people say that one must not use repertory. Why one must not use repertory? Whenever there is a case, whenever it's complicated case, one has to go into the repertory and find out the similar rubrics and the similar remedies for that case. So when Dr. Henneman had himself said that the repertory is a must, when people say that repertory is one of the tool for case taking and for prescribing, then why one must not use the repertory? Always try to use the repertory efficiently and always know the difference between the repertories which you are using, especially if it is a general repertory or it is a clinical repertory, and always you must know about the philosophy of the repertory before using it. I don't say that you must not use repertory, always use repertory in each and every case, and if you think that the repertorization is not necessary in this case, then don't use the repertory. But if you think that repertorization is necessary, when you think and you know that you are coming towards your favorite remedies only, or you are guiding the patient while case taking towards a remedy which you have in the mind, then do not give that remedy. Always take upon your repertory, open your repertory software, put in the symptoms, put in the totality, and find out all the similar remedies which come up after putting the totality of symptoms and the repertorial totality, and then think of giving the most similar medicine after confirming it from the Materia Medica. So always use repertory and always confirm your remedy from the Materia Medica. Thank you everyone for watching this video. Please like, share and subscribe to my channel and spread this video to all your friends who want to learn more about homeopathy.